Hi everybody, I'm Dr. Clark Schierle, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery, and this is Monica, one of our PAs, and today we're going to talk to you about facelifts, neck lifts, facial rejuvenation, kind of try to clear up some of the confusion.
So, who's an ideal candidate for a facelift?
Well, pretty much anybody that is looking for an improvement in the rejuvenation of their face. So if you find yourself looking in the mirror a lot and doing this or this is the neck, this is the face. The incision for a facelift typically is going to go in front of the ear, and for the neck lift goes behind the ear. This is kind of a simplified way of thinking about things. But a facelift is going to help to reposition your cheek back up if your cheek has kind of fallen over time and turned into a jowl. If you've noticed dark circles forming under your eyes, maybe your nasolabial folds or these lines here on the corner of the mouth, we call them the marionette lines. If those are getting more noticeable, those are all things that a facelift can really help with. And then similarly, a neck lift, if you're looking in the mirror and you start noticing double chin, some cording or banding, loose skin down here, and it really looks a lot better when you do this, then a neck lift may be right for you.
Is it right for me?
No comment. So facelift, neck lift is going to involve some kind of repositioning of the skin and usually the deeper tissues also of the neck and the face. You can think of it simplistically that you have skin, fat, and muscle in all of these areas. And all of those are tissues that we do address and reposition during a good face and neck lift. It varies a lot in terms of the technique. I use about 6 different techniques for face and neck lift. I was very fortunate to be trained at one of the great programs here in Chicago, Northwestern, and saw a variety of different facelifts that really go deep and lift up and reposition the muscles. Other facelifts that are much easier, quicker, some that can even be done in the office that simply involve tightening those tissues with stitches. And so some of these are going to have a couple days of downtime. If you're looking for a little nip tuck that's going to make you look great and still be ready, makeup ready or camera ready in time for a big event that's in a couple weeks, we can tailor it to someone who's younger and doesn't need as much of an improvement and has less appetite for downtime. On the other end of the spectrum, someone that has more of a need for more comprehensive facial rejuvenation, maybe someone a little older who has more of an appetite for downtime and they're looking for a longer, more powerful result, longer lasting result. Some of these might take a month or so before you look more normal, but then the payoff is that it's going to last a lot longer.
Yeah, I would say bruising can take anywhere between 1 to 2 weeks to really kind of settle. Immediately after the procedure, we do wrap every facelift and neck lift with an ACE wrap, and we really want patients to be good about wearing that wrap as much as possible, honestly, for the first week. Because we don't use drains in our facelifts or neck lifts, so we want to kind of decrease bruising, decrease swelling, and decrease any possibility for any bleeding. So that wrap is very, very important.
This, like with many cosmetic surgeries, is a function of how quickly things are changing. So for someone who's older, if they're aging more rapidly, the face of the neck lift is really going to reset the clock. They're going to look great. It's going to look like we've taken 5 or 10 years off of their face. But then if they're continuing to experience aging, gravity, sun damage, you name it, the results aren't going to last as long. And that's where actually our med spa comes into play. I recommend that 100% of my patients are integrated fully into the non-surgical side of our practice, where they're using the right kind of skin creams to maintain their result, to protect their investment, as well as ongoing skin treatments that help to maximize collagen, elasticity, skin tightening, so that the results last as long as possible. Typically, you can expect a facelift of ours to give you noticeably better results for at least 5 to 10 years. That's my goal with every facelift.
I have patients come into a consultation asking, I just want a neck lift, or I just want a facelift, I want a mini facelift, I want a mid facelift. Can you kind of like tease that out a little bit for our viewers so they have a better idea, the nomenclature? And I feel like every surgeon kind of talks about it differently as well.
Yeah, like many areas of plastic surgery, there's a bunch of kind of colloquial terms that are out there in the press and that are used on TV shows or whatnot that don't necessarily correspond with the surgical anatomy or technical description of these procedures. So when I hear someone that's looking for a mini lift, or even if there's some other less aggressive facelifts that have even been trademarked by certain companies and are performed by certain outfits that are maybe a little bit less well trained, let's say. What I'm hearing is that they have less of an appetite for downtime, and they're willing to maybe give up a little bit in terms of the longevity of the procedure to get something with less downtime, faster recovery. And we can definitely flex up or flex down to match their goals. So again, this involves fat repositioning, removing some extra skin, elevating the skin, tightening the skin, elevating the muscle, tightening the muscle. When you do these things more aggressively, you're going to have more swelling, more bruising, less, more downtime. But ultimately, some of those results may last longer. But some patients either don't need that much or don't want that much. And we can definitely make the procedure less aggressive in exchange for a much faster recovery, faster downtime. And if you want to call that a mini lift or a weekend lift or something like that, these are all things that we try to understand what they're saying, what they mean. And as long as I can understand what they're talking about and they can understand what I'm going to deliver, then we can work together and make their goals a reality.
Definitely. Typically during our facelifts, we also perform some facial rejuvenation with fat grafting. So it's very similar. It's like a natural filler. We use your own fat and kind of reposition it into areas where that has been depleted over time. So gravity does take a toll on your face. So really focusing on the mid face. So tear trough, cheeks, temples, and it really kind of gives that facelift just a cherry on top and just makes the results so much better.
Yeah, no, for over the last 20 years or so in the aesthetic surgery literature, there have been a number of pioneers, Joel Pessa, Rod Rourke, who have described the importance of volume. So it's not just that things are dropping and need to be lifted, but they need to be filled as well. So volume depletion is as important or more important in some patients as the actual repositioning of the skin. And this is one of the reasons why we do so much facial fat grafting in the office. So facial fat grafting as a simple office procedure is a very powerful way to rejuvenate the cheeks and all the areas that Monica discussed. We are really happy at Northwestern Specialist Plastic Surgery to provide the full spectrum of care from surgical to non-surgical with our full featured med spa. And what I love is that as a surgeon, having those tools at my disposal, when I see a patient that's interested in facial rejuvenation, it's very important, first of all, that they have a comprehensive plan that involves the right skincare, the right kinds of creams that are going to optimize their growth factors and nutrients to make their results as good as possible, as well as ongoing treatments in the med spa, microneedling, laser treatments. A lot of these treatments will do things that my surgery can't do. Fine lines around the mouth or the eyes, we don't reach that with the facelift. And so those are going to be better treated with a laser treatment. A lot of my facelift patients will undergo a laser treatment in conjunction with their facelift. It's really, as far as I'm concerned, part of the whole package. As well as there's some patients who aren't ready for a facelift, in which case we can do a whole number of procedures as simple office procedures. I like to call, affectionately, the everything but the facelift. We can do an upper eyelid lift, we can do facial fat grafting, chin liposuction, profound skin tightening. All of these are simple office procedures that provide sometimes 70 to 80% of the benefit of a face and neck lift with significantly less cost and downtime and a much faster recovery.
And I sometimes think that some of these procedures we can do, instead of a facelift, are a good way to kind of prep a patient for a facelift. If they're like 2 to 3 years out, doing these things ahead of time are really going to make their facelift much more dramatic and drastic, I think, in the future.
Yeah, for sure. I mean, it's none of these things are harmful to the eventual facelift. And actually, as Monica was saying, they kind of prime your skin and make the skin healthier and more rejuvenated, so that we're lifting skin that's in better condition. Which ultimately leads to a much better result.
Yeah, and patients ask, is this a waste of money if I do these other things instead of kind of putting all my money towards a facelift? I say absolutely not. I think that if you are not a candidate for a facelift today, you may be in a few years. So this is a good way, to really kind of kickstart your just facial rejuvenation process early, as opposed to waiting a couple more years.
So hopefully that helped to clear up some of the confusion between what's a facelift, what's a neck lift, what other things can I do to look my best, feel my best in terms of facial rejuvenation. Please feel free to leave any questions that you might have in the comments below. Subscribe to our channel to learn more in the future, and make sure to click that bell for notifications when we post new videos. Thank you very much. Have a great day.
Thanks, guys. Have a good one.